All right. Hello and welcome again. Today we have the honor and pleasure of speaking with Dr. Aajay Shah. He's a board certified cardiologist and a board certified lifestyle medicine specialist. Welcome, Dr. Shah.
Oh, thank you, Dr. Pradhan.
So can you tell us a little bit more about yourself? Give us another introduction.
Sure. So again, I'm a board certified cardiologist for the last 25 years. I got board certified into lifestyle medicine. I'm in Michigan. I work full-time cardiologist for a small size hospital. I still see patients every day. My practice philosophy has changed now over the last 3 years with more into lifestyle changes and a primary prevention, at times going away from pushing pills and procedures. So definitely a new way of practicing medicine for me for the last 3 years.
What started you on this journey?
So 3 years back, my A1C, which is the measure of a 90 days average of blood sugar, where we measure whether a person is pre-diabetic or diabetic or not. And my A1C was 5.9. Essentially, I was becoming pre-diabetic. I was obese. My body mass index, which is the measure of height and body, was actually 31. So I was definitely about 50, 60 pounds overweight and in an obese category. All my family members on my mom's side, all my uncles, my mom herself are diabetic. Some of them are on insulin. I never wanted to go on any diabetic pills or on insulin for sure. So that was a wake-up call for me to prevent and reverse that pre-diabetes for myself. So I started exercising. I started eating whole food plant-based diet. The switch for me was almost an instant switch. I became whole food plant-based within like 1 to 2 weeks. At home, I have a supportive wife, so we start pretty much eliminating all the processed food. Our pantry got cleaned out, our refrigerator got cleaned out. We started buying more vegetables and fruits. Our oil is gone actually from our house almost for now 6 months. My wife has joined this journey about eating whole food, plant-based, no oil. She has lost significant amount of weight. And to give you and give your followers and friends and viewers a great news that my A1C, which was 5.9, now is actually 5.1. My A1C is actually better now than our son, who is only 30 years old, 31 years old. So I've reversed my pre-diabetes. My blood pressure is gone. My cholesterol is down. I sleep 7, 8 hours soundly. I exercise almost 2 hours every day. And I think I turn around my major concerning health history.
So how fast did you notice a change? So you said you went plant-based like within 1 to 2 weeks. We're going to talk about more about what that means, but how fast did you notice a change when you made that change in your body, yourself,
yeah.
and in your labs maybe, and in your blood pressure?
Yeah, in terms of my energy and my overall well-being feeling, like productivity and just having a great time during the day was within 2 to 3 weeks. My blood pressure started getting normalized within about a month. My weight was coming off almost about 8 to 10 pounds per month. So weight loss was very rapid too, actually. I lost my 50, 60 pounds within 6 months. So weight loss was very rapid. Like I said, my productivity improved. My snoring was gone. I probably had a borderline sleep apnea. My sleep apnea was gone. My exercise capacity improved. I ran 2 half marathon, which I wasn't even able to walk like 1 mile. And I ran 2 half marathon at a decent time. And I was 55 years old. So I think that the turnaround was very rapid. Within 6 months, to be honest with you, I was a new person. Actually, I had more energy than when I was even 30 years old. And a lot of my friends and family who had not seen me for a year, they almost felt like I was a new person.
I'm sure you felt like a new person. That's just wonderful. So so you've told us how it affects your personal life, and it's affected your wife's labs probably, and her weight loss and her trajectory on health and longevity. How did you bring this new knowledge that you had to work, to your professional life?
Yeah, so again, my wife joined the journey. She has lost, she didn't have to lose that much, but she has lost 15, 17 pounds. Her labs were always good, but her labs are better now. Her sleep is better. She is more active, more fit. She looks great. And actually now she has started her own a healthy cooking show on our Facebook page. So that was a great, kind of a project for both of us to jump in. That whatever benefits we both have realized, to start spreading that message to all friends and family. My work has significantly improved. I'm not tired at work anymore. I'm always fresh. I actually have a lot more energy to talk to my patients about healthy lifestyle, about eating healthy, about exercising, about sleeping. Patients are loving it because, patients typically come and see a doctor, and many times doctor give them 3 or 4 or 5 or 7 minutes and just prescribe 1 or 2 pills and then come back in 3 to 6 months. Now I'm able to spend more time about their life, about their friends, about their relationship, about their eating. And patients are actually, I always took my patients as my friends and my family, but now I'm more so even in their life more than I used to be, in the past. So I think now I'm truly enjoying practicing this holistic medicine, which I think to me is a lot more joy as a physician and a lot less chance of burnout. So I actually found a new kind of a passion to practice medicine for next 15, 20, 25 years.
I agree with you. I mean, people love stories. Do you have stories of patients that have changed their lives because you changed your life, and it's just a ripple effect, hopefully, and
Oh
especially with
yeah.
your Facebook page? I mean, you're spreading the message, which is, it's an honor to know that you're doing that. But do you have stories of patients
Oh,
that you
for
can share
sure.
with
I have
us? If a
many,
complaint, of course.
yeah, I have many stories, but one patient I clearly remember, 65-year-old male, diabetic on insulin, already had a bypass surgery, was about almost 250 pounds, so he was in an obese category. He came to see me first time. He wasn't that much motivated to make lifestyle changes. So I explained him the importance of lifestyle changes. I showed him some of my videos, and he actually, whatever the reason, maybe he was tired of seeing doctors every month, every 2 months, taking all these medications, taking insulin. He watched all my videos. He started following our Facebook page, and he actually gave me even a better results and response than I did it myself. He lost almost 50 pounds like in 4 or 5 months. His insulin was gone. He was walking better. His symptoms of chest pain were gone, and he actually was feeling like this is like adding almost 20 years to his life. At 60, 65, and I think he was 65, he almost had given up on his life. He felt like now he is pretty much done with life. There's nothing left for him to do. He wasn't looking forward to the next morning. Now he's looking forward to his grandkids' graduation, his grandkids' wedding. I mean, he feels like he's going to keep going on and on and on. He's like a new person again.
What did you tell? I mean, I know he watched the videos and that's how he got started. Did you provide individualized kind of tell him what to eat, what not to eat, or did he do exactly what you did? Just kind of cold turkey, go whole food, plant-based?
He actually was a meat and potato eater. He was a typical mid-Michigan person. But whatever the reason, he started adding a lot more vegetables and fruits to his diet. I did not ask him to go vegan like I am, and I think you are, but I asked him that add at least vegetables and fruits, and that trick actually worked because when he added vegetables and fruits, his fiber intake in the diet started going up. And because of the fiber intake and because of the satiety and fullness he was getting from vegetables and fruits, automatically his meat intake went down. And that's a thing I tell all my patients that don't eliminate anything, just add more vegetables and fruits, and automatically the unhealthy food will start to go away. And many patients, actually, including him, started changing his taste buds for the healthier thing, including salads and fruits. And I mean, his switch was not overnight switch, but in a month or so, he was plant predominant. He did not become vegan, but he became plant predominant. And same with walking. I always ask my patients to just start walking 5, 10 minutes every day and build up 5 extra minutes every week. And most of my patients, within 3 months, they're walking 45 minutes to 1 hour.
Well, you're spreading a wonderful message. I am about a 98, 99% vegan. I'm going for that 100% like you and trying to influence my family to do the same. Um, But your Facebook page is so wonderful, and your wife's cooking page, I think, is spreading the message so wonderfully. Um, do you have any last closing words for us, just to encourage us to keep going on the journey to improve our health, empower ourselves?
Yes, actually, I ask all our friends and family to join in this journey. I think life is precious, and there are simple ways you can become healthy, happy, and live long. With all the technology, all the knowledge about lifestyle we have available, we can easily live up to 100 very healthy and happy and very active, and can see our not just grandkids, but our great grandkids graduation. So why not? I think if we do it, and you all can see on my page, there are different pillars of living healthy, being successful person. If a person starts eating whole food, plant-based as much as possible, lower the processed food, lower the animal products, start moving at least 30 minutes, 40 minutes a day, sleep 7 to 8 hours, not have any major substance abuse, manage the stress well, and have a great relationship in the family, with spouse, with kids, with friends, I can assure you that you will live happy, long, and very healthy. Your healthcare costs will go down, your productivity will go up, and you will become a very, very successful influential person, not just for your family, but for your community.
There's such powerful messages. I mean, that's what life is about, right? Having happiness, having health, and without health, we can't have happiness or wealth. So just love that you're sharing the message so strongly through your website and through your podcast. I remember we talked about you're also going to launch a course to help patients as well in the near future. So I'm so excited to see all the wonderful things you're going to bring to us to help us live healthier and continue on this journey called life.
Now, I think I admire your work also. I think you are also a leader. You're being an ophthalmologist. You are getting into lifestyle medicine. You know, cardiologist, I can understand, has a lot of need for lifestyle medicine, but becoming for an ophthalmologist to jump into lifestyle medicine is not commonly seen. So I really, really admire. I'm very proud of you. And I think your website, I've seen it, is already up and running. It's great. I think you will have a great, great response from your friends and followers. Plus, I think you always have appeared to me as a kind, soft, not a pushing person. And that's the reason I think your friends and followers are very lucky to have you as their coach, have you as their physician.
Oh, I'm standing on the shoulders of giants, as we all are. Ophthalmology has been a leader in looking at lifestyle in general. There's so many studies about cataracts caused by smoking or poor diet, glaucoma worsened by smoking, macular degeneration worsened with meat intake. I'm going to be trying to compile some of those and get some of the specialists that have put together these large multi-center studies to help us know all of this about our eye health. I'm just a messenger standing on the shoulder of giants who have done all of this wonderful work before me. So, but I appreciate your kind words. Thank you.
Yeah, thank you very much.